Hello, and welcome to another edition of Calm in the Chair, a patient's guide to IV dental sedation. I am your host, Dr. Vincent Monticcciolo. Today, we want to cover the topic of patients with dementia and Alzheimer's disease. For me, this topic hits close to home, as my family have loved ones that have struggled through these conditions. So, for the most part, they do progress and then unfortunately become more and more challenging. How does sedation dentistry fit into this demographic? As these conditions progress, the patients can become combative and very resistant to good oral care. Unfortunately, most typical dental offices cannot treat these patients as the disease progresses in a typical setting. So today we want to touch on three things. Number one, the key challenges that the caregivers are facing. Number two, the health complications that result from poor oral health in these patients. And number three, the advantages of IV dental sedation to help treat these patients and their conditions as they worsen. So let's get it started. Number one, caregivers. Caregivers of patients with dementia or Alzheimer's disease face several challenges when trying to maintain good oral hygiene. As cognitive and physical abilities decline, so does the patient's ability to cooperate or even understand the need for dental care. Here are the key difficulties caregivers often face. Number one, resistance to care. Patients may refuse or resist brushing due to confusion, fear, or simply not understanding the purpose. This can lead to agitation or even aggressive behavior during oral care routines. Communication barriers. As the diseases progress, patients may struggle to express dental pain or discomfort. They also may be unable to follow instructions or cooperate during oral exams or hygiene routines. Number three, forgetfulness and inconsistency. Individuals with dementia may forget to brush their teeth, even if they were once very diligent with their oral care. Also, they might also forget to brush or use toothbrush incorrectly. Number four, motor skills decline. Loss of fine motor control makes it hard to hold a toothbrush or floss. This often means the caregiver must take over completely, which can feel invasive to the patient. Number five, behavioral and mood changes. Anxiety, paranoia, or depression can make patients more sensitive to touch, especially around the face and mouth. Routine tasks like brushing can become emotionally distressing for both the patient and the caregiver. Time and energy demands. Caregivers managing multiple health needs often prioritize immediate concerns, unintentionally neglecting the patient's oral hygiene. It can become exhausting to perform twice daily brushing with a resistant patient, and also lack of training. Many caregivers, especially family members, lack training in proper oral care techniques for cognitively impaired individuals. They may not know how to safely assist with brushing or maintaining the oral tissues. So the biggest concerns happen to be the health considerations. Poor dental health in patients with dementia or Alzheimer's can lead to a range of serious health complications, especially due to their reduced ability to communicate, discomfort, or maintain oral hygiene. Here are the risks and infections associated with poor dental health. Number one, gum disease or gingivitis and periodontitis. Inflammation and infection to the gums can progress with the patient not even realizing it. Untreated gum disease can lead to both tooth loss and systemic inflammation. And then dental abscesses, which we see a lot in this patient group. Untreated cavities or gum infections can form abscesses, which are painful and can spread infection to other parts of the body, including the jaw and bloodstream. My biggest concern is aspiration pneumonia. Poor oral hygiene increases bacteria in the mouth, which can be inhaled into the lungs, especially in patients with swallowing difficulties. This is a major cause of pneumonia in the elderly and dementia patients and can literally be life-threatening. And this is what we see a lot in our elderly, in our dementia patients, is they're swallowing all this infection and eventually it leads to pneumonia. A fourth consideration is malnutrition. Dental pain, broken teeth, poor fitting dentures. These all make it difficult to chew or eat properly. This can lead to malnutrition or dehydration, which worsens overall health and cognitive function. And then number 5, chronic pain and behavioral changes. Dental pain often goes unreported by dementia patients, showing instead as aggression, withdrawal, or confusion. Proper oral care can prevent unnecessary discomfort that can affect their quality of life. And lastly, cardiovascular complications. So chronic gum infections are linked to heart disease and stroke due to the bacteria entering the bloodstream and causing inflammation in the blood vessels. So what are the advantages? How can we help? What are the advantages in treating dementia and Alzheimer patients with IV dental sedation? Well, number 1, it reduces anxiety and confusion. So patients with dementia may become anxious, confused, or frightened in an unfamiliar environment like the dental office. Sedation helps keep them calm, minimizing psychological distress and the risk of behavioral outbursts. It also enhances cooperation. Many dementia patients may not fully understand the instructions or may resist treatment. Sedation improves cooperation by relaxing the patient, making it easier for the dental team to perform procedures safely and efficiently. It prevents injury. Patients who are disoriented or physically uncooperative are at a higher risk of injury during dental care, both to the patient and to my staff. Sedation reduces sudden movements and agitation, lowering the risk of self-harm or procedural complications. This allows for comprehensive treatment. Sedation can enable the dental team to complete multiple procedures in one visit, minimizing the number of appointments and reducing overall stress on the patient and their caregiver. It improves comfort and pain management. Even if the patient cannot effectively communicate pain, sedation helps manage discomfort and provides a more pleasant experience. And lastly, it reduces the caregiver's stress. Family members and caregivers often worry about their loved ones and how they will handle a dental visit. Knowing the patient is calm and safe under sedation helps reduce anxiety for the caregivers also. So to wrap up, we treat these patients daily and truly understand the challenges that are involved in treating these patients, trying to maintain their oral health, trying to maintain their function, and keep them comfortable. If we can be of help, we are here. We're available by calling 813-DENTIST, or you can check out our website at happydentistry.com. So until next time, stay healthy and keep smiling. Thank you.